Welcome to another acid reflux update video. I first and foremost just want to say thank you to everybody who's shown support and has left a comment on any one of my videos, hoping that I'm healing okay and feeling better and that the surgery has worked for me. Thank you so much. I appreciate that. It's great to see kind of this community of people forming, going through the same stuff. From my last video, I was giving everybody an update of my first surgery. I think I shot the video the day before I actually went in for the surgery, which is crazy to think that it's been that long since then, but it has, and here I am again giving you another update. The surgery date was June 24th of 2020. Today is October 4th of 2020, and it has been about 3.5 months post-op. I've actually been feeling pretty great. It's a blessing to finally feel like I've gotten a hold on this horrible condition. For those of you who don't know, I have been dealing with this since I was 10 years old. Doctors telling me that I was just making it up in my head or it was anxiety, which obviously were contributing factors to making me feel even worse, but mostly it wasn't in my head, because the doctor that I'm seeing now finally realized, okay, there's something actually wrong with this girl. Let's do some tests. And sure enough, there was something wrong with me. And he fixed it, and I'm feeling a lot better now. So for this update video, I'm just going to go through kind of the steps leading up to the surgery. Also, how my recovery process went, because I know a lot of you are asking about kind of like how I was feeling after the surgery as well. A lot of you trying to undergo the same surgery and just needing a little bit more information. With that being said, I don't want this to come off scary to some people. For someone who has gone through this twice, I do know that it affects people differently depending on the period of time, how much has to be done during the surgery, even your recovery time in the hospital. It all comes into play, so I don't want this to seem like it's gonna happen to you exactly the way it happened to me. So I'm just gonna start off by explaining kind of the moments leading up to the surgery. So first, I was brought in, first and foremost, for a COVID test 3 days prior to the surgery date. If you are getting your surgery done during a pandemic, which you probably are if you came to this video, chances are you're going to have to get a COVID test. I did it through my hospital that was actually providing the outpatient care, so you would probably go to the hospital and get the COVID test, and that's just as a precaution. They obviously don't want any patients there for outpatient that aren't healthy, and that could put everybody else at risk who is in outpatient. So you'll have to go in and do that. I just got my nose swabbed. It's not that big of a deal. I've heard people like kind of afraid of it or think that it hurts or whatever, but it's not that big of a deal. It lasts 2 seconds and then the pain's gone. Then when I had my COVID test, they actually gave me, they call them drinks at my hospital, which is just carbohydrate drinks that you would take in the days leading up to the surgery. So the carbohydrate drinks are just Ensure drinks, and they're honestly just the most sugary thing you've ever tasted in your life. It's almost like a thick water, but it tastes like strawberry jello that's sugar-free, if that makes sense. It's not that bad, and this is from somebody who's really bad at, taking anything in liquid form. But it was kind of hard to drink after a while. I definitely recommend drinking it cold. And actually what helped me was using a metal straw. I'm not sure why, maybe because the metal helped keep it cold as it was even going up the straw. I'm not sure. It was easy for me, and if it's easy for me, it's probably gonna be easy for you. I guess they just give you the carbohydrate drink to help you have more energy after your surgery. So I think you take them the day before, and then you take two the day before, and then you take one, I think, the morning of the surgery, but it depends on the time of your surgery. if you're getting your surgery done during the pandemic, then you really are only allowed to have one visitor at a time. And I'm not sure if the policies have changed at all, but for me, I was only allowed to have my mom there. And they kind of had to like take turns, and you know, you obviously have to wear a mask. But that was kind of scary because I didn't think they were going to let my mom in at all, and I just kind of really have just relied on her support throughout my whole journey of this. You could always call the hospital and double check and see if they do allow visitors. That way you can better plan out who's going to come and support you, or if they have to wait outside or something. That way your family members are a little bit more prepared for what's going on. So obviously the day of, you're not supposed to eat or drink anything. I feel like I don't even have to talk about that though, because your doctor will actually tell you what you need to do based on your surgery time. So in my last video, I did mention that my doctor suspected my surgery from last year to have come undone, which is why I was experiencing symptoms again. And that's exactly what happened. I ended up waking up after the surgery and I asked my mom what happened. She was thankfully sitting right by my side, and she said that he had to redo basically everything that he had done the last year. And we think that it was due to me surfing too early after my surgery, which is going to cause the pressure kind of on your abdomen where the hiatal hernia and the stitches are, which my doctor said that it does take about a year to fully heal. When she told me that, I was kind of emotional about it. It felt like I had wasted all of my time doing it last time, and now I'm having to go through it again. So it was really frustrating to wake up to that, and you're still kind of coming out of the anesthesia and everything. So after my mom told me what was kind of happening with the surgery, I did realize that I was experiencing some shoulder pain in my left shoulder, which I was experiencing the same pain as I was in my first surgery. But it did feel like it was a little bit worse, and I don't think it was because of the procedure itself. I think it's because of the medication that they decided to prescribe to me. Last year I definitely got morphine and I was on a pain pump, but I think maybe my hospital was trying to refrain from doing that because maybe some people have gotten addicted or whatever it may be. So they ended up giving me tramadol a lot of the time, and I just didn't feel like it was working. The first night I woke up at 1 a.m. crying because I couldn't get in a comfortable position and sleep, and I had to signal for the nurse and get morphine injection basically, and that seemed to help a little bit, but I don't think they were giving me enough that I needed for it to actually take the pain away as much as I needed it to. So that was really, really frustrating. So I did stay overnight in the hospital. The next morning when you wake up, the doctor needs to perform a upper GI swallow test. And that's, I guess, to make sure that there are no holes in the surgery so that if you were to eat or drink anything, that it's not going to spill out into your body cavity. I will say the only thing about that is they try to give you, and I feel like I've said this in the past, but they try to give you the, I forgot what it's called. Okay, I think it's called GastroView or something. Maybe GastroView or, wow, I need to look it up. Oh, yes. Okay, so I think that GastroView is a brand, but gastrografin is actually the type of substance that it is. That stuff is probably the worst thing I've ever tried in my entire life. It doesn't taste like it's edible. Most medicines don't, but this one is like to the next level. I'm just a baby with that, like I said before. So I begged and begged and begged for them to just give me the barium swallow, which was even just hard enough to swallow as it is because you're so swollen and nothing is going down and everything. But obviously, if you have an intolerance to like certain bad tasting medicines and you feel like it's going to make you be sick, I would tell your doctor that you're concerned about that because you really don't want to put any strain on the surgery. Like anything like vomiting is going to really cause the stitches to be strained. So I was able to complete the swallow test and everything was perfectly fine, and my doctor was really impressed with how strong my swallowing was already. And I was actually tolerating some Jello and some soup and the Italian ices that they would give you. So he was really impressed with that, and he really didn't want to keep me in the hospital for too much longer because of the COVID-19 restrictions and the risk of that to me recovering from surgery. So he decided to discharge me from the hospital the next day. Now, in hindsight, I probably would have tried to stay in the hospital a little bit longer, due to the fact that the very next day after the day that I was discharged, so this is day 2 after surgery, I just couldn't, for the life of me, swallow anything. Not even just water or just sucking on ice chips. The pain was I can't even describe how painful it was, but if I can describe it the best that I can, it felt like when I was swallowing that whatever I was swallowing, the water had nowhere to go, or it just wasn't being contracted the way that it normally does when you swallow things. And then just an immense amount of air would just come up, and it would get stuck in a certain spot that caused me some immense pain. And it also felt like it was shooting out to my shoulder, which was really weird, and that never happened to me before, like in the first surgery that I had. So I was really caught off guard by it. It was scary. You know, after a couple of days of that and me just trying to slowly eat ice chips, I didn't feel like I was improving. I felt like I was getting worse. So when that happens, you start getting really scared and thinking that, oh no, the surgery didn't work, or, you know, something is wrong. He needs to go back in and fix it. So we called the doctor and let him know what was going on. And I was also very dehydrated, so the doctor told me to go back to the hospital to get a rehydration. I don't even want to mention how long it took me to be seen to get rehydrated, because that's just the hospital's fault. But I ended up having to go back to the hospital 2 times to get rehydrated, because after that whole week I was still not feeling like I could swallow with confidence or without pain. And it truly was really scary, because I was only trying to swallow water, and it wasn't like I was trying to eat something really thick or anything. And, you know, my mom was really concerned. She didn't know what to do. You know, my boyfriend was really scared, and he didn't know how to help me. And it was just a really stressful time for everybody. I just want to mention that this didn't happen to me in my last surgery, which was in 2019. Yes. I felt like I was ready to eat everything at that point. I was ready to move on to the next thing. So this happening to me was really concerning, because I was like, this is not how I was feeling before. There must be something wrong. But the difference is I did get a fundoplication, which is the you know, physical wrap of your stomach, versus the TIF, which is using the device to flip your stomach and then just fasten it. And I can leave some links down below to some videos that explain more about the TIF procedure and the fundoplication and what the differences are. I think that's in my mind, I was like, this isn't right. I should be feeling so much better and not worse as the days go by. So that was the hardest part of the whole recovery process. So my doctor thought the reason why that this was happening is because the swelling was just immense. There was so much swelling that, oh my gosh. So there was so much swelling there that the air that was trapped in my abdomen from when they inflate your stomach in the procedure wasn't getting released properly, because everything was just kind of really tight in that area. And my doctor explained it to me that while you're swallowing and actually opening that area, that the gas will try to escape once that area is opened. After the 3rd time of me getting dehydrated and still not being able to drink properly, I'm pretty sure this was around week 2 of the recovery process, my mom and I were just really concerned. So we called the doctor again, and we told him, look, she's still not able to swallow. We need to do something to figure out what's happening. The bad thing is my doctor was actually out of town during this time that we were trying to get more answers. So he had a friend who was also a gastroenterologist who said that they would do an endoscopy. So that's the one where they put the camera down your throat or the endoscope, to see what's happening. I was scheduled for that on a Friday. I'm pretty sure it was July 3rd, the day before 4th of July. And again, with the hospital, I was there all day, just waiting to be seen and being in the worst pain ever. And I remember it got so bad that I really couldn't even swallow my own saliva without getting pain. And there was some position that I was able to put myself in that would allow that air to get released how it needed to be to give me that relief. I can't even really explain it. I hope this is making sense. After the endoscopy, the doctor did say that everything looked normal, the procedure was a success, and nothing was really being blocked. So after hearing that, I'm like, okay, they're thinking I'm crazy again, because I can't swallow water and I have to keep coming back to the hospital during COVID to get hydrated. So that was really frustrating for me. And then the doctor recommended that I take some kind of stress reliever, which my mom ended up finding some stress gummies that honestly did really help me like stop thinking about it, because I guess that could have caused some more tension in the abdomen. After that day, I remember just being so tired from the anesthesia and from being there all day long and just being stressed out because I wasn't feeling good, and honestly being left alone in the outpatient room waiting to get my procedure done, which was stressful. But, I pushed through that, and then, once I got home, I was super tired, and then I just passed out. I remember passing out, waking up, and then I was like, okay, I'm gonna try to eat some soup because I need something in my body. If I don't have anything in my body, I'm gonna wither away and it's not gonna be good. So I kind of just put myself in the mentality of, okay, you're gonna do this. So I had to almost figure out my own way of tolerating things that was like working for me. So I ended up finding this really good position, which you think it would be counterintuitive with acid reflux, but it was almost like a reclining position. Like, I wonder if I can, it was almost like this level of reclining. That was really working for me, just being in that reclining position, and then also taking the tiniest sips that I could possibly take, and it was helping me just get the soup down, and it was going down. And some of them I would take a little bit too much, and then I would be like, okay, that was painful, let me take a break. And then I would take a break, and it was just a process trying to swallow anything. So that was the night before 4th of July. Now I remember on the 4th of July, I woke up, I was like, I'm gonna do this, it's happening, like, let's drink some water. And actually, in the morning, I know I was able to eat or drink half of one of those Premier protein shakes, just very, very slowly, sipping it, to where I found like this routine that was really just working for me. By the time it was lunchtime, I think, and I was like, okay, I'm gonna try to drink some tea now, because maybe a little bit of the honey and a little bit of some kind of flavoring will help it go down a little bit easier, and it's hot, so it'll definitely go down a little bit easier. So I remember it took me basically watching a whole movie to drink a whole cup of tea just by taking it and sipping, and that was kind of helping me, get it down. At least just get something in my body. So that really worked, and I think after that I was like, all right, this is the plan. This is the routine. I've found the thing that works for me, and I'm just gonna keep at it until I feel better. I had been doing that for about a week, and I was able to actually start taking my prednisone pills, which is the steroid that's supposed to help with the swelling. And every day, I'm telling you, I felt a little bit better. And it was finally almost this like weight lifted off my shoulders that I was like, okay, we're gonna be okay. And, all the bad has come to an end, and it's only up from here. I mean, I went on with that mentality, and you know what? I was able to start drinking whole Premier protein shakes just like that by maybe week 4, which seems scary, like to most people, that it took me that long to recover. But sometimes it just takes that long. It's gonna be different for everybody, and it's just important to know going into it that if you do have a longer recovery time, that you have to keep pushing through it, and that it's going to be okay, and there's a reason why this is happening. And like everything's just gonna be okay. And I feel like I just had to keep reminding myself of that, because it really was putting a lot of stress on me and a lot of stress on my family, and I was worrying a lot of people, but you just push through it. That's basically it. So after I started tolerating liquids, I was pretty much like ready to move on to other things, and I started with like mashed potatoes that were a little bit watered down so that it could easily go down. It wasn't dry or anything going down. And you know, it was like another week of that, and then you try to introduce a little bit more. Like my doctor actually told me that I was able to start, you know, shredding up some chicken and mixing it with sauce and then just eating it like that. And you know, my go-to was Chick-fil-A because I would get the grilled nuggets and cut them up really small, mix them with Chick-fil-A sauce, and then, you know, that was my thing. And I just had a, you know, Oreo milkshake. I would just have that, and that would fill me up, and it was perfect. The only thing is, when I started introducing a little bit more solid foods, I did start getting some rebound acid. And rebound acid's kind of like when you've been taking PPIs for a long time in your life, that your body is just used to that formula, used to that recipe that you've been giving it, and it's hard for your body to kind of wean off of that. I think that's my biggest struggle with recovery, is trying to get off of those medicines, because actually I did have to start taking PPIs again. I'm on Nexium now, the over-the-counter 24-hour, because I felt like it was just keeping the burning down. But as far as my other symptoms go, I'm not having any regurgitation, any nausea. I actually learned how to burp. I've never been able to burp before in my entire life. That just makes you think like, wow, did I have this problem for longer than I think I had this problem? It's just amazing that, you know, one day it could change your entire life, and you go through this journey that you didn't think you were ever going to be on, and then it just happens. And it's like the best thing ever to feel like you can go out and be social and, you know, I mean, not now, obviously, because of the pandemic, but still, like, I'm able to do my work after I eat. Like, I can get dinner with my boyfriend and not feel sick after. I used to have to lay down after eating, which is also counterintuitive, but that would help me not feel nauseous. But that all has subsided. I've been able to live my life. Obviously, I still have to kind of watch what foods I'm eating and, you know what affects me and stay away from those things. But overall, 110%, if you're having problems and a doctor's telling you that you don't have those problems, you need to just keep going. You need to like find another doctor that's actually going to help you solve your problem, preferably like a surgeon who can actually fix the anatomy of the problem and not just who can actually fix the anatomy of what's going on. Because other doctors who just prescribe medicines and you're like, it's not working, but they're like, I don't know what else to do for you, then you need to go find somebody else who's going to help you. Because let me tell you, the biggest thing that I learned about going through all of this is the patient really is their own advocate when it comes to this stuff. I mean, you know, acid reflux is just kind of a widespread thing in America and probably other countries too, but I feel like mostly America because of the stuff that we eat all the time, and all the chemicals that we consume on a daily basis because we're Americans and we like our snacks and processed foods, you know, and because it's so popular, I feel like there's almost like this careless attitude that I get personally from certain doctors who just are like, you're fine, just keep taking medicine and you'll be fine. It's like, I'm not fine. There's nothing fine about being a 24-year-old girl who just wants to go out with her friends and be social and, you know, be able to go travel and everything without feeling like they're sick every single day of their lives. And it's like, I have so much respect for my doctor who has really believed me through every step of the process and really has solidified that I'm not crazy and I know my body and I know when there's something wrong with it. And that's my biggest advice to you guys who are going through the same thing or thinking about getting surgery and your doctor's telling you no because you're too young or too old or whatever, it's like, you do what you want to do if it's going to improve your life. I feel like I've kind of covered everything that I wanted to talk about, but if you guys have any questions, as usual, just leave them in the comments and I will respond to any question. I hope everyone is staying happy and healthy during this weird period of time, and I hope that this video helped you get a little bit more of a peace of mind and kind of a first-hand experience of what it's like to go through the surgery. Again, I don't intend to scare anybody away from the surgery. Like I said, I'm probably one of the biggest advocates for something like this. I'm just not sugarcoating it in the way that it is hard. It's definitely a process to go through. The recovery time is not the easiest, but you will get through it and it will change your life for the better. So that's it. I hope you enjoyed the video. Please give it a thumbs up if you did. And then I will see you in the next video about acid reflux or whatever you guys want to talk about. But anyways, thank you guys so much for watching again. I hope you have a great day. Bye.